we're discussing major depressive disorder or depression. A 54-year-old male found to crying in isolation. He lost his wife 2 years back. Now he has decreased appetite, low mood, and loss of interest in living. He has no children and lives alone at home. Symptoms for at least 2 weeks from depressed mood, plus following sage caps symptoms and no mania. Sage caps uh, S for sleep disturbance, then A for apathy, guilt, exertional fatigue, concentration loss, appetite, power, and suicidal thinking. Then we are going with pathogenesis, hyperfunction of monoamine neurotransmitter system, including 5-HT, serotonin, and noradrenaline. Hyperfunctions or reduced its amount, and abnormalities of HPA axis, which results in elevated cortisol levels. Clinical features or symptom of depression is psychological, and we divide into two: psychological and somatic. In psychological, there is harmonic DG, SPRLL, D for depressed mood, G for guilt, S for suicidal thinking, P for pessimism, R for reduced self-esteem, and double L, loss of interest and loss of enjoyment. Then there is somatic, and I made this BMW fussel, B for bowel disturbance, M for motor retardation, W for weight change, and F for fatigue, A for appetite, S for sleep, and L for loss of libido. The negative triad in associated with depression is negative view of self, current life, and future. The investigation is same as we discussed in dementia. And now indication referral to psychiatric is failed response greater than or equal to 2 interventions, recurrence within 1 year after present episode of depression, more resistant suicidal thoughts. Then we are discussing management. In management, we discuss 5 points: physical therapy, psychotherapy, social therapy, pharmacotherapy, and electroconvulsive therapy. Physical therapy, we do avoid drugs and alcohol, regular exercise. In psychotherapy, CBD, and interpersonal therapy. Social, we deal with financial, employment, housing, and childcare support. Pharmacotherapy, we discuss it later. And electroconvulsive therapy when medical therapy fails. Now we are discussing pharmacotherapy. First class of drug is tricyclic antidepressant, TCS. Drug includes amitriptyline, nortriptyline, amipamine, clomipamine. Mechanism of action: reuptake inhibitors of serotonin and norepinephrine. Side effect is postural hypotension, prolonged QT, and anticholinergics. Okay, now with SSRIs, estalopram, fluoxetine, sertraline, selective serotonin reuptake inhibitors. Side effect: sexual side effect, insomnia, agitation, and serotonin syndrome. Next he has monoamine oxidase inhibitors, MAO, and these drugs include phenelzine, selegiline. It inhibits metabolism. It is not a reuptake inhibitor. It inhibits metabolism of 5-HT and noradrenaline. Side effects: orthostatic hypotension, weight gain, and hypertensive crisis. Next we have is NRIs and SSRIs. It includes venlafaxine, duloxetine, desvenlafaxine. It is noradrenaline reuptake inhibition. Side effects is postural hypotension and rashes. Then we have the noradrenaline and specific serotonergic inhibitors, mirtazapine. Side effect is zero, stomy and dizziness, constipation, skin rash. Then we have the next drug, Namda and methyl D aspartate antagonist. Memantine is drug and side effect: nausea, hypertension, diarrhea.